mothers describe? Or what kind of changes do you expect?
Like, have you guys talked to? Of course, you had children.
Yeah.
Have you talked to anybody that has had children before? Have they
Yeah,
described
we have, pretty much
about
all of
the
our
post-
friends have kids, so.
Have they talked to you about the postpartum period yet? Like what they went through, what to expect?
Not really.
No.
Okay. What about you, Antandra? Do you have anything? Do you remember your postpartum period?
You know, I haven't felt like that,
Fine.
you know, after having any one of my babies. I've talked to people that, you know, that were kind of detached
Mm-hmm.
or, you know, just feeling down,
Mm-hmm.
looking down, you know, but I thank God I have never experienced that.
Did you breastfed with all of them?
I breastfed with, not with my first because of course I was 14, so it was like, no, I'm not even getting ready to try that.
Mm-hmm.
But with my second, I did it for like a month.
Mm-hmm.
And then my third, it was like 3 months.
Mm-hmm.
But then my fourth and my fifth, it was like 5 months and 6 months. So 6 months has been the longest that I actually breastfed.
Well, we're going to answer a question for you because if you remember us talking about the breastfeeding and those hormones, the oxytocin, which is the hormone that helps the milk come out, is also a natural mood elevator. So a mom who's breastfeeding has a much lower chance of postpartum depression than a mom who's not.
Oh.
It's not a 0 chance, it's a lower chance.
Oh.
Okay. What have you noticed or heard when visiting new moms? Have you been in the presence of new moms? What have you noticed about them?
I like that look, Katie. You're like, answer.
She gives it me all the time.
That was you better speak up.
I think about Lisa.
I think about Lisa too. That's
When
the
she
only
had her
thing.
twins.
Yeah.
She just felt so overwhelmed with
Yeah.
her twins.
That was the one word that came to mind was overwhelmed. So.
But I went with her to the NICU as much as I could, and I tried to help her as much as I could at the house, and
Right. And of course, nobody here's having twins, and that's a lot of work, so we're glad
plus
for
she
that.
has 2 older boys.
Okay.
So, God bless her.
Okay. Yeah.
And dad's in the military, so
Yes.
it's not a lot.
So she needed a halo at that
Yes.
point.
Yeah,
Okay.
yeah,
Just making
she
sure.
still needs a halo.
Yes. But, you know, overwhelmed was the thing I really heard. And you know, I think it would be okay for everybody to have that. You know, you were new moms and a new dad, so being overwhelmed trying to figure out this new person. Antandra has a new baby. She's going to have all those pressures, but she has 4 older children as well.
5.
I'm so sorry. She has 5 older children. That's
I
even
do that
worse.
Yeah. So I'm just waiting for them to be fighting over the baby because baby's like,
Which will
when your
happen.
baby coming out? When your baby coming out? I'm ready to see the baby. I'm like,
How old is your youngest right now?
my youngest is 4. She'll be 5. She'll be 5 actually on the 30th of this month. Yeah. Her and the new baby might have the same birthday.
Aww.
That's what I'm aiming for because I am tired. I think I'm more excited to get my tubes out than to have the baby.
I've heard that before too. What changes will occur when you bring your baby home?
Oh my gosh, that's a big list.
Everything?
Yeah.
That's the answer.
Yeah.
There will be
Yeah.
nothing that will be the same.
Yeah.
Where you live.
Yeah, well, yeah.
That even changes.
Yeah.
No way.
You'll have the same parents. You know, I mean, yeah, every part of your daily life will change for the better in most cases. Have you heard of baby blues? Yes. I know you've heard of it because I talked to you about it a couple times. But baby blues is 1 to 3 weeks after you have the baby. It is literally crying because the shirt is blue. She's wearing glasses. The room is this size. Literally, it could be anything that small, and you can cry for hours. Okay? I had a client, her husband had to make her stop watching TV because there's that diaper commercial where she takes 12 bags and forgets the baby and goes outside and has to run back for the baby. Then she has her next baby and she puts 1 diaper in her purse and leaves. Okay, so her husband had to take the TV away because every time she saw that commercial, she cried for 2 hours. And they played that commercial like every 2 hours. So, okay, that simple. It is perfectly normal and does not mean anything is wrong.
Do that now.
Okay. That's pregnancy hormones.
Pregnancy hormones.
Yeah, that's normal. And what new parent
With it.
support groups are out there?
Do you know about any parental support groups?
You were just on all day.
You know what? We need another job as a model.
I think he wants another package of crayons.
I have colored pencils and
Those will sell in your car.
Yes, we do have a support group with parenting and breastfeeding support at the same time. Definitely your Healthy Start Care Coordinator or the rest of us are here to help you. There's definitely other groups out there such as the La Leche League and Mommy and Me and the like.
Your friends.
There's a moms group.
Yes.
Yeah. Yeah, one of our friends goes, not to the one in Mount Dora, but
You went to one of the meetings.
yeah, what is that town called? Past us, past Eustis. If you keep going on
Minnesota?
9, yeah, I think it's there. But yeah, I went to it once.
And you know, nobody knows what you're going through in this stage of pregnancy or right after you have a baby other than moms who are going through it right now. So, after the first few days after you have your baby, first of all, involution. This is when the uterus goes back from the big balloon that has a baby in it all the way back to its normal pear shape. Breastfeeding will enhance this process because it makes it go a little bit faster. The contractions that are caused after pains. Now, after pains are not true contractions. They don't hurt that bad, but you're definitely going to notice them. The one thing that will bring them on is breastfeeding. However, that's why it goes faster. The uterus will return to its non-pregnant size in approximately 6 weeks, although most of the involution occurs directly afterwards in the first couple of days. You can continue to bleed for up to that 6 weeks. Relaxation and breathing techniques, such as we've talked about for labor and delivery, can be helpful. Your doctor may talk to you about some kind of mild analgesic like a Tylenol or an Advil. Again, if you're breastfeeding with the approval of your pediatrician. Lochia. Lochia is the vaginal bleeding that comes after you have a baby. It's going to start out bright red, which they call Lochia rubia, to a brownish pink, Lochia serosa, within a few days. There may also be a whitish or yellow Lochia alba by 2 weeks postpartum. If it returns at any time to bright red, you should contact your doctor immediately. That means your uterus is bleeding. The normal odor of a lochia is like that of menstruation, just a little stronger. The foul-smelling odor could indicate you have an infection and you need to talk to your doctor immediately. Heavy perineal pads can be used when the lochia is heavy, so you may have to use the hospital pads or the hospital underwear that they're going to give you. Change your pad every time you go to the bathroom, even if there's just a few drops, because that can help increase your chance of an infection. Use the peri bottle that they're going to give you. It's like a squirt water bottle to rinse yourself off. You're not going to be able to use toilet paper right away. Pat yourself dry, front to back 1 time. It's okay if there's a little bit of fluid left. You're going to use your pad for that. And you may not put anything in your vagina until your postpartum visit, especially tampons.
Like I'm doing Samson.
Listen, when my sister was in the hospital and they said this, I was there and they were telling her about that, and my brother was like, "Oh, so that's where the remote goes." I was like, "Oh."
Okay. So he's a jerk, but that's okay.
I was like, "Oh my god."
Yes. So nothing in the vagina, and actually it can cause a lot of issues if you do. So none of that. The peritoneum is going to be swollen and have poor lubrication postpartum. Normal mucus may not resume until ovulation, so it could be a little bit of time before that lubrication comes back. Most lacerations and episiotomies heal within the first few weeks. The first week with stitches is not fun, but it does get better, I promise.
And that bottle is your best friend.
Yes. Topical analgesics or
Wine
anesthesics.
bottle.
No, that Terry bottle, like I did not have enough. I mean, but it's a wonderful thing. I think I used it for like a year.
I had a client that carried hers around in her purse and she called it her best friend. Yes, I remember. My best friend's in my purse. All right, I don't need to see it. Cold flex, swelling. Kegel exercises, as long as you don't have tears, you need to ask if you can do Kegels after you have your baby. Will help increase blood flow to the peritoneum and speed your healing. Some women also find that heat lamps help to dry out their sutures so they go faster. Think of like the big wide heat lamp that they use like to hatch eggs. That's kind of what they're talking about. Some hospitals still have those. And no sex until the peritoneum has healed, and really until the postpartum, to make sure that everything is healed, the uterus, the cervix, all of that. Urinary function, expect frequent urination, since the body's going to be getting rid of a lot of extra fluids. Urination should not be painful or burn, but inability to urinate is a problem. That can happen sometimes just from the trauma of delivering the baby. Self-care, a sitz bath. It should be SITZ.
I know, it all corrected.
Okay, that's all right. The sitz bath or sitting in a shallow tub of warm water can help make urination easier. And ambulation and drinking enough are helpful. So for bowel and bladder movements, I mean, you can wait because you know it's not going to be comfortable, but nobody's going to recommend that because it's just going to hurt more in the long run. Your skin, you're going to have night sweats. This is perfectly normal as the body gets rid of all these excess fluids.
It's just never ending.
No, it's really not. You are not going to enjoy the
I don't see
postpartum
the blankets
period.
now.
Okay. However, all these terrible things are going on with your body, but you're going to have the babies, so it's going to be well worth it, I promise. Okay? Keep the room cool, wear cotton gowns and change them frequently, cool showers. Your breasts. Now, it is pregnancy, not breastfeeding, that cause changes to the breasts. Immediately postpartum, the breasts secrete a thick yellowish fluid known as the colostrum. Remember I showed you that smaller cup was the colostrum. The colostrum contains nutrients, antibodies, and protein. It does not have any fat, so we do expect your baby to lose a little bit of weight to begin with. On the second or third day postpartum, the breast will become tender, swollen, firm, and warm as lactation starts. This will likely occur whether or not you choose to breastfeed, and it can be uncomfortable, especially for moms that aren't breastfeeding and having that milk removed. And they do call that my milk coming in. Within days, the colostrum changes to the transitional milk that's not as yellow, and then transitional milk will eventually become mature milk. Mature milk is whiter and thinner than transitional milk, and if you remember, transitional milk has the two parts, and they're the bigger cups that I showed you. Self-care. So breastfeeding mothers should nurse every 2 to 3 hours. This will establish the milk, and this will keep the breast empty to avoid we'll just call it the bad stuff. Try avoiding engorgement, which is when the breasts get overfilled, by nursing or expressing the milk. Engorgement triggers the brain to produce less milk, so that can be bad if you really do want to breastfeed long term. If your breasts are engorged and the baby cannot latch on, meaning your breast got a little bit too tight, you can hand express a small amount, you could pump a small amount, you could go in the shower and hand express a little bit and let the milk come out. The breast softens up, the baby can latch on. Once the milk has come in, the mother may experience a tingling, some women say prickly sensation as the milk comes out or during the letdown. That is normal, but most moms don't usually feel that. The letdown reflex is usually stimulated by the baby nursing, but it can be stimulated by environmental factors. So if you're in the garden section of Walmart and there's a baby crying in the pet section, guess what's going to happen?
Grey's Anatomy, that's what
Yes. I always think of that episode where
Yes.
Tony's in there crying because she's got that poison ivy all over her. Bailey's like leaking everywhere.
Okay. That is actually a true thing. Women who are not breastfeeding should wear a good supportive bra at all times, even when sleeping. Ice packs and acetaminophen can relieve some of the discomfort. Engorgement will subside within a few days, and there will be less discomfort. Basically, if you're choosing to breastfeed, you want to wear a good supportive nursing bra. You don't want anything that's too tight or anything with underwires that can cause the plugged milk ducts.
You should wear a bra at night.
You don't have to.
No?
It's a comfort thing. If you're leaking a lot, you may choose to.
Right.
But no, and think about back in the olden days, moms didn't have bras; they were still breastfed, so it's not
And
necessary.
they do have sleeping nursing bras. Like I know Target sells them, and they're just essentially a wrap.
Mm-hmm.
Okay, so hemorrhoids. Hemorrhoids may result from the pregnancy itself or from the delivery. The discomfort can be relieved by the use of stool softeners, taking fibers like whole grains, adequate fluids, and the use of topical medications such as Preparation H or Tux. Now, these are again drugs, even though you're just putting them on your rectum. You do have to talk to your doctor first if you're breastfeeding. So here's some of the complications that can happen. These are really infrequent, but if you do have any of these symptoms, you do need to talk to your doctor. Fever over 100, clots that are bigger than a quarter, or bleeding that is heavier than a normal period, Discharge that is painful, has a foul odor, or is foamy. Symptoms of a urinary tract infection, urination that's painful, burning, or urgency. Signs and symptoms of mastitis. One breast is hot, tender, red. Really, it hurts so bad you just want to give it to somebody else. Signs and symptoms of thrombophlebitis. Pain, swelling, tenderness in one leg. That would generally be in the back of one calf and be quite painful. Nausea and vomiting, chest pain or cough. And if you have an incision from your cesarean that gets bigger, more tender, or sometimes they open. Definitely.
Now I have a question for you. As far as them saying a normal period, is it normal to your body?
Yes.
Okay.
Yeah. Like yours is probably gonna be heavier.
Right.
So, some needs for the new family. Your emotional reactions. Thank God that's over. Yeah, that's going to be number one. Relief that everybody's safe. Satisfaction or dissatisfaction with the infant. If your baby's not what you thought it would be, or it's more cry, or your baby has some...
Now you offended her.
I guess she knows how I know. But, you know, some families think, well, I wanted a girl and I got a boy. And that can cause even something as simple as, or, you know, I thought my baby would have dark hair like the dad and the baby's got red hair. Any of those things could cause that. Dissatisfaction or satisfaction with the mother's labor and birth performance. Katie, you were just too loud and I'm all upset with you.
You better not say that.
I was going to say, don't say that, but, you know.
I'd like to see my baby grow.
Yeah.
Or you had a vaginal, or you had a C-section and you really wanted a vaginal.
Right.
I was telling Virginia the other day, I've never been the person who thinks I'm not, like, I don't want to have a C-section, but I'm not against it. Like, if it happens, it happens. And with my high blood pressure and everything, I've always put it on the table that it could happen. So.
And, you know, you're going to be emotionally tired. This has been a long pregnancy. Pregnancies are hard. We know that. And, you know, just kind of like, I'm so glad my body's back, and I'm so glad I can just take a second and just, but then again, the baby's going to want stuff. So emotional fatigue can happen as well.
They're like a punishment. That's the longest punishment I put myself on ever.
That is not the final opinion of Healthy Shark. Maybe you should be a motivational speaker all the time.
She's had 5. Just remember that.
Like this one here, this hands down, this is mine. I don't like this pregnancy. I got too old for
You're a
this.
little bit older, yeah.
Yeah, I got too old for this.
That's like, I didn't drink Coke the whole time I was pregnant with Micah. And after I had him, I like had the C-section and like they brought me in a Sprite and I was like, if someone doesn't get me, I'm gonna lose my mind. And he's like, well, I'll ask Mr. Guy. I was like, you give her Coke.
There is no asking.
There's no
Just
asking.
make it happen.
I was like, I don't get a Coke. He's like, you're on the liquor. I was like, I don't want a Coke.
I just want to go on the record and say babies are not punishment. I just had to say it.
Not the baby, it's just the pregnancy part. I don't mind the baby.
That's
So,
good to
like,
hear.
We're gonna team up because I like being pregnant. You can raise the baby.
All more power to you. I could deal with the kid all day.
Wow. I don't think any of that's in the curriculum.
I'm sorry.
Rest. Anytime you can rest. That baby takes a 5-minute nap. You need to take it as well. There is nothing more important than your rest, besides the baby. So housework, cooking, cleaning, anything, none of it is more important than you sleeping. You need to eat healthy. And we're talking as healthy as you did when you were pregnant, making sure that you're getting all your whole grains, fruits, vegetables, proteins, and dairy. Adequate fluid intake. You're going to feel like all you're doing is urinating from getting out all those extra fluids. But you're still going to want to drink the 6 to 8 glasses of water a day. Why? Because your breast milk is going to need it. Once you're dehydrated, it can lower the amount of milk you can make. You do have to make sure that you're clean, especially in your peri area. We do not wish you to get an infection. But we also want you to be warm and comfortable. Remember, just because you have a newborn does not mean your house has to be 90 degrees, because none of us want to visit that. We would like you, but And possibly pain relief. Having stitches, or especially C-section, are painful. If you need that, please take it. Okay? Even the narcotics you're given, if you're given them, are okay with breastfeeding, because only a little bit goes through to the breast milk. The mother may need to process her birth experience. Something may have happened that really upset you and shock you even, but you have to process it. And it's okay to grieve if you have your section instead of your normal baby, or if you had a labor that took 12 hours instead of the 5 you hoped for, that sort of thing. Mother may be prone to crying as a result of hormonal changes and lack of sleep. Interaction time one-on-one with the infant, with each parent separately and together, that's really important. And reinforce an approval of family and friends. If you come in, if one of us comes in and says, "Blah, blah, 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 but you're doing good," that's not what you need. If your mom is saying that, if you're, we've had a lot of issues, I think, with grandmas, we can say that easy with, "Oh, wrap that baby up," or "It's so cold in here, warm it up."
You're holding the baby too much. You're spoiling
Yes,
it.
yes.
They could be so elegant.
Again, I will reiterate, you cannot spoil a baby under 6 months.
I
Hold
can't
that
believe you're
baby.
breastfeeding. It's so nasty. "Oh, I'm so sorry you feel that way. That's the door."
Please use it.
Yeah.
And don't come in.
If you
Don't
need
let
somebody to
me
stick
slip.
up for
Don't
you, you
slip.
call it on time.
They can be so annoying.
Yes.
I'm telling you, like,
Yes. And remember, in the hospital, if you need somebody to leave, you let your nurse know. You're not going to have a nurse at your house, but it's your house, so deal with it.
Always call her.
You
I
can
can
call
come
me.
home
I
if
can
I
come
need
over. Hey, you gotta leave. Virginia's coming over for a visit.
I can't help you with your mom because you live with her, but, we'll have to think a little bit more on that one.
lock the door.
Yeah, I just started packing my hospital bag. I picked out all the outfits, and then my mom comes in and she picks out all the different outfits to take. Said, "Oh, you should take this one just in case.
Yeah.
You should take this one."
That's gonna be her baby. You better do it.
You guys will have some growing pains,
Yes.
and we will help you through it. It will be okay. So, the support of others. You can get a postpartum doula or have somebody assume the role of a postpartum doula. A really good friend who stays with you and helps you and has the same goals that you do, okay? If it's your mom and she doesn't agree with breastfeeding and you've chosen to breastfeed, don't use your mom, okay? Assistance with meals. Anybody can cook a meal for you. I have no say on what it tastes like, but anybody can cook meals for you. Assistance with chores. Okay, I don't want anybody washing my underwear either, but, they can sweep or mop or something along those lines. You could give somebody a grocery list. Assistance with the care and transportation of your older kids or pets or whoever need assistance with. Any assistance that will help you with time so that you can rest. Can your mom call and make doctor's appointments for you and the baby? Can your boyfriend or your husband spend a little time working with the food stamp system to get the baby added on? Listening to the mom's birth story. This is part of healing. So if she wants to tell it over and over and over, listen. Watch the baby so mom and dad can sleep or shower. And creating special big kid time for the older kids. Very important.
And I always like to mention, if somebody wants to come visit the baby, they need to come do a chore or bring food.
Yep.
Otherwise, they don't come.
And it's awkward the first
Pizza
several
rolls.
times you ask for that
Pizza
to
rolls.
happen, but when my stepdad died, someone called and they were like, "Jill, do you need anything?" And I was like, "He cleaned the toilets, and we don't know where a toilet brush is. So if you could bring us one, that'd be fantastic." And they did, and they got there and they cleaned the toilets for us. And they're like, it's a little thing, but it's something that if someone comes
Any
over
little
and they
thing
say,
helps.
"Hey, can I help?" Hey, there's
Yeah,
dishes.
don't
Yeah.
feel like you can't say
Right.
no. Don't help. I say make it a requirement. If you want to come visit me and the baby, you bring the food or you come do a chore.
Yeah.
I did it
for a friend of ours. We got to her house. I'm like, let me finish the baby's laundry for you. She's like, what? I'm like, yeah, just let me do it.
I'll do the baby's laundry.
He comes in
No.
and sniffs it.
Go find in the nursery, just like face bending over the baby's clothes.
Well, I could tell just from the other day when y'all showed it to me. She's like, "This is the baby's room," and then he goes in there and he's like,
Yeah.
pulls stuff out of the closet that I haven't put up yet.
Oh, you guys are going to fight over that kid. Okay. Supporting the decisions that new parents are making about parenting. Grandparents, great-grandparents, great-aunts, especially need to remember that it's your baby. And although grandparent advice and approval is nice, you are the parent. It is your child. Hard sometimes, I know.
Be easier for us.
It's easier when no family's around.
Well, it will be harder in some ways as well.
Oh, yeah, absolutely.
So,
Yeah.
We have
definitely.
people have signed up for slots to come stay with us.
Good. Let's see. Mom will go through the taking in phase. The mom is oriented primarily to her own needs in life. We take care of ourselves first. And she may be passive or dependent. But she will have to discover the infant. She will have to take the baby in and learn new behaviors. She discovers the infant by touching, noting physical attributes, relating infant behavior to other family members. Chris, this baby farts 24/7. She must be yours, kind of deal. Yeah, okay. Interpreting the infant's actions and perceived needs. The mother must process the birth experience and identifies the baby as a separate individual. There's a whole psychological or emotional change that has to happen in a woman after her child is born. The taking hold phase. The mother strives for independence and autonomy. She's mine, I'll do it. She becomes less passive and more the initiator. Oh, she needs a diaper, I'll do it. Okay, Chris, this is not something she can take care of. She's saying, I'm doing it. Yes, ma'am. Okay. She needs reassurance that she's doing a good job and is successful as a mom. She may be concerned about bodily function and her control over them. She should have pooped at 2 o'clock. It's 3 o'clock. There's no poop yet. Oh my goodness. This is normal. Yes, we get this one, boss.